Hi, I'm Dr. Matt Hansmeier. I work here in the urgent care at Western Wisconsin Health, and I'm here to talk a little bit about heat exhaustion and in our theme of heat illnesses as well as heat stroke, which is apropos to the weather that's coming down the pike this July. Hopefully you all have a way to stay cool, but we're going to chat first a little bit about what is heat exhaustion versus heat stroke. So the names themselves are a bit explanatory. Heat exhaustion literally means you're exhausted from heat. Our bodies were designed with a very unique way to regulate. A lot of the processes in our bodies, the enzymes, the way it work within a very tight temperature range. In fact, you can have a change of 30 degrees in your environment, and yet your body's internal thermostat can regulate that within 1 degree. So it's quite incredible. However, that doesn't mean we need to throw caution to the wind. And so heat exhaustion happens essentially when your body gets too warm. And if you don't treat it, it can lead to heat stroke. So if you think about heat exhaustion is the precursor or the milder form of heat illness before heat stroke happens. Heat exhaustion, those are the things that you're going to experience, such as muscle cramps, heavy sweating, pale or cool skin, weakness, dizziness. In our day and age of smart devices, it can be fast heart rate. Sometimes your urine is darker. And then when that moves on to the more serious form called heat stroke, that's a fever. We're talking 104 degrees or higher. That's heat related confusion, fainting, seizures. In many ways, we say in healthcare, heat stroke is neurological symptoms, or you're confused or disoriented related to illness, versus heat exhaustion. When again, those are caused by your body losing too much water, not able to keep itself cool. This is not something you treat with Tylenol. This is something you treat by removing yourself from the environment. You can recognize this and prevent this, and that includes watching people around you, not just yourself. Some of the basic measures that we do so we don't get to this are wearing the appropriate clothing, protecting yourself from the sun, wearing hats, using sunscreen, drinking plenty of water. It can be sports drinks or things if you're active, thinking about how much fluid you're losing if you're sweating. And then being mindful if you're drinking a lot of caffeine or alcohol, things that cause you to lose more fluids. And of course, if you're thinking about scheduling events, consider the time of the day that you do this, maybe in the cooler evening after 6 o'clock, and taking breaks from the heat in indoor and outdoor activities. And some of us, depending on what medications you're on, sometimes people are on antibiotics or allergy medicines or blood pressure medicines that can make you more prone to this. And of course, if you recognize this, immediately take these measures to prevent yourself. And if you see anybody with heat stroke symptoms, that's emergency 911 and get them out of the heat. So hopefully you can still enjoy the summer that we have. And we'll probably be talking about cool related illnesses in 6 months, but let's take advantage of what we have now and have a great summer.